Okay, so welcome to today's talk, and we are going to talk today about an interesting topic, and we are going to talk about prolactinoma. First of all, let's try to understand what is a prolactinoma. It's basically a benign tumor, a kind of a adenoma of the pituitary gland, and it produces a hormone called as prolactin. I want to tell you, most cases which I have treated prolactinoma are cases where they are kind of an accidental form of investigation where there is actually no symptom. They just did a random scans. There is certain headache, there is certain pains, little vision problems, and when you do a scan, you do a CT, MRI, and you find a tumor. So no one diagnoses prolactinoma as directly. It actually often could be just accidental finding, which I have seen more commonly. And you have to see the area of pituitary gland to really understand what the prolactinoma means. Clinically, the mass effect is going to cause a lot of headache, and one of the other symptoms that could often happen due to the compression of the optic chiasma and cranial nerves is kind of rhinorrhea. But typically, a lot of vague headache, dizziness, and ophthalmic symptom. What I've seen, vision loss would be number one. And basically, in allopathy, there are a few treatments available. There's some hormonal treatment available, surgeries are available. But there are two possibilities because homeopathy acts at a very deeper level. And I have good cases where prolactinoma has shrunken with the help of homeopathy. One possibility is you can take homeopathy along with allopathy, and together once they kind of can shrink the tumor. The other possibility is you can actually have total faith only on homeopathy and wait and watch every 6 months and do the scans. And both ways homeopathy is very effective. It actually depends a lot also upon the belief of the patient. And I just recently there was a very interesting case of prolactinoma, huge tumor, benign tumor in the and his main symptom was vision issues. Remarkably, he improved on medorinum. His main symptom was he used to think a lot, he used to plan a lot, he used to make a lot of ideas, and he had a lot of pressure of doing everything in time. Anxiety, time set, constant pressure, a lot of restlessness, a lot of worried, anticipation, avoidance. He did very well with medorinum. Another case I remember, I had given carcinosin, and it shrunk within 5 months. So there are some good results in prolactinoma. And like in any case, we have to individualize, we have to go to the depth. Homeopathy, the idea is to individualize the case, to understand how it started, to understand the exciting factor, to understand the stressful situation that actually caused it, to understand the experience of the person. We all perceive life in different way, and we try to understand what is your perception, and then build the internal panel. We try to understand the inner pattern that's causing all of this. But there are certain homeopathic remedies which I've used more often than others, and I'm going to give you some ideas about it. One of the remedies that I use very often is bromium, and especially in female cases, I've also used when bromium has a pituitary adenoma, and along with that, also a lot of mammy issues, tumor issues in the breast. But typically, there's a kind of a guilt feeling in bromium that I've often used. Another remedy, asafoetida. Again, very hysterical remedy. Patients requiring asafoetida can be the most hysterical people with very loud hysterical eruption. Lycopodium I've used very often, and many cases with lycopodium I've done well. One of my teacher, Dr. Vijay Vaishnav, I saw had a couple of very good cases with thyroid in them. And, Iodoform, this remedy I use in low potency with a history of ringworm, craving for meats, and recurrent cold and cough. When no remedy acts in this kind of cases, you have to use pituitary, anterior pituitary, the sarco, for remarkable results like this. Last, this is Banerjee's remedy, and often you can use as an organ-specific remedy, Ruta 6. The main symptom for Ruta to prescribe is a lot of fear of cancer and a lot of fear of darkness and desire for light. With this kind of totality, Ruta 6 I've used very often. So these are some thoughts I wanted to give you. This is a very brief topic. Very recently I am seeing many patients are being diagnosed with prolactinoma, and homeopathy is a very good option for them. This is my email ID. You can write to me, and if you want me to consult in this case, you can write to me also. For homeopath students who are watching this, we have to take up more cases like this, evaluate, have more evidence-based homeopathy, and it's an amazing science. This.